Okay, welcome everyone. As more attendees are rolling in, I'll give this a minute or so before we officially get started. We still have attendees coming in, so we'll start here in 1 minute. Okay, I think with that, we'll go ahead and get started as attendees are still trickling in. So thank you for joining us today on today's webinar. My name is Dr. Ethan Hunt, and I am an assistant professor in health promotion and behavioral science at UTHealth Houston School of Public Health in Austin, with a research center affiliation here at the Michael and Susan Dell Center for Healthy Living. The center, which is hosting today's webinar, has a vision of healthy children in a healthy world and a mission to advance health and healthy living for children and families through early and impactful interventions. And our intentions are threefold. One, to create new research ideas and trainings for public health students, to communicate evidence-based products and outcomes to researchers and legislators, and to connect with communities and other public health organizations. Next slide, please. You gotta go number 2.
Yep.
Yeah. I would like to recognize the Michael and Susan Dell Center, or Michael and Susan Dell Foundation, for making possible the center's activities, including today's webinar. Next slide. Information about our center's work, including center resources, can be found online, and please scan the QR code on your screen to access additional health resources. And next slide. In addition to previous resources, our center leads the Texas Research to Policy collaboration, which creates the legislative related resources described on this slide. You can scan this QR code to learn more here as well. And then please note that the slides and recording of this webinar will be archived on our website. And if you have any additional questions on the presentation, please enter them in the chat, and we will field those at the end of the presentation. And without further ado, I'm excited to introduce our speaker today. Dr. Augusto César de Moraes is an assistant professor of epidemiology, human genetics, and environmental sciences at UTHealth Houston School of Public Health in Austin. He is also a research investigator here at the Michael and Susan Dell Center for Healthy Living. His research interests include the role of structural social inequities in heart health and brain development, impacts of malnutrition on cardiovascular health in pediatrics, and the relationship between environmental factors, lifestyle behaviors, and health outcomes. So with that, I will now hand it over to Dr. Augusto to start the presentation titled Youth, Child, Cardiovascular, and Environmental Health Perspectives from South America. Go ahead.
Thank you, Ethan. Thank you, everyone, to be here. I just want to say thank you for our director, Dr. Vandenberg, our chair here in Austin, Dr. Huscher, and thank you, my colleague, Ethan, to moderate this nice webinar. So I will talk about it, some perspective from South America related with mainly pediatrics health. So just want to start with no conflict of interest. All this information that I will talk here, I will express myself and not reflected or the University of Texas or UTHealth at Houston or the Michael and Susan Dell Health Center. So just brief summary, I'll talk starting with cardiovascular health epidemiology. What is the prevalence in South America? Some indicators and how this is important to address, and some association with lifestyle and environmental factors in South America, and cardiovascular health in pediatrics, how we can evaluate that and how we can improve your methods and how is the most recently evidence we have in this. I will bring some evidence from our project, Say Care study, and future challenges that you can address to reduce disparities or reduce this prevalence of cardiovascular risk factors in the adult population. So as we know, so cardiovascular still has the higher prevalence and incidence to cause of death in the worldwide, even during the pandemic phase. If we compare here with cancer, it's more than 4 times when you compare the reason people die cardiovascular disease against cancer in both sex. So but how is this important in pediatric health? So far as I know, when I was children, we think in cardiovascular disease is adults or elderly problem. So it's not this right now, is pediatric problem as well. So this systematic review we carry out a few years ago, we find almost 10% of the children across the globe presents high blood pressure. And how this is important, high blood pressure is the most risk factor for cardiovascular disease, such as stroke or heart failure or another cardiovascular disease. So if they start in the early phase of our life, so this can be the tricky key for develop this kind of disease. But what is this important for South America as low-income developing countries? As you can see here in this table, for boys, we have strong related factors with low-income countries. So as I say here is low and middle-income countries present higher prevalence when we compare high-income countries. And this is we show in boys and the total population. And another important thing here is the measure methods. So with measuring the blood pressure with the digital monitor is related with higher prevalence. So another important thing, how we can measure that. So we'll talk on this later. So just highlighted here, and when you're thinking in obesity and you're thinking the high income country present higher prevalence and higher incidence. However, when we see high blood pressure, we show in this systematic review, the low and mid income countries present the higher prevalence for high blood pressure. So it's a huge health issue to address as a public health politics or public health intervention. So in Latin America specifically, we found higher prevalence as well. Here we have 2 countries, Brazil and Argentina, and we have here in the left side, girls present almost 12% present high blood pressure, and when we see boys, they present almost 15% of high blood pressure. So if you see another cardiometabolic indicator here, present as well higher prevalence. So again, as you see in the previous slide and see here again, and cardiovascular risk factors is present higher prevalence and incidence in this kind of population. So this is important because when you're thinking in the lifespan, this adolescent have almost 15 years up to 18 years old. They can live more 16 years with these risk factors. And this can reduce the quality of life, it can reduce morbidity, and can reduce mobility, and this increase the life cost and increase the healthcare cost as well. So this is important to us to understand what's happened in these countries. So as we know, all this no communicable disease is strongly related with life behaviors. And this is another publication we did. We tried to examine physical activity and sedentary behavior related with blood pressure. Because as we know, this is important lifestyle behavior to reduce obesity indicators and can reduce as well the blood pressure. What we found here was when the girls from Brazil, for example, they have the health combination, such as higher physical activity and lower sedentary behavior, they present almost 2 millimeters of mercury when we compare the girls that have unhealthy behavior. So this is the same parameter for diastolic blood pressure in girls and boys. However, in boys, when the boys present unhealthy behaviors, lower physical activity level and higher level of sedentary behavior, they present almost 3 millimeters of mercury higher when we compare the adolescents practice physical activity. So we have some indicator that lifestyle behavior can reduce or increase if you practice physical activity or not, and the blood pressure. So it's one indicator that we can address these risk factors, promote physical activity, and reduce sedentary behavior time. So this is important because when you try to promote physical activity, you can address different non-communicable disease, such as I said, obesity indicators or blood pressure as well. So this is a multiple target you can address to promote health behaviors. However, as we know, Dr. Diehuk said a few years ago, and sometimes we want to practice physical activity. Sometimes we want to go to a park to play sports or something. However, we live in some environment to not have this access of this resource. So this is a good sentence that I like. She said, your zip code is more important than your gene code. And what she said here is sometimes you have to address environmental factors to promote health behaviors. Here, some concept framework, and not talk a lot of this because we see this later, but if you address some environmental factors, you can have affect different health indicators here. We'll talk on this now. So sometimes it's hard to measurement environmental factors, and we have two different approaches. The first one is direct observation, as here you see the interviews go to the neighbor and try to access, evaluate, for example, sidewalks or streets. As you can see here in one place in South America, these don't have a good sidewalks and don't have good streets structure. So this will be hard. People go outside to walk or jogging or play sports, for example, for the kids play sports on the street. So this is hard to observe some opportunities they practice physical activity. So Juan, a few years ago, again, he tried to make some systematic review, as we did in blood pressure, to understand another possible direct observation is related with blood pressure, for example. And he found pollution is strictly related to increase blood pressure levels in children as well. As you can see here, this one parameter, air pollution, and they can increase size 0.75 up to 1.8 systolic blood pressure, millimeters of mercury. Oh, this is important because we are exposure for you live in one neighbor that have higher level of air pollution. You can so suffer these effects almost 50% of the day or more than that. So if you long time on this, you can increase only your blood pressure because you live in bad environment neighborhood. So this is important to address to reduce air pollution. And reduce air pollution, we can reduce a lot of different factors in our life. So climate change and as well health issues. However, sometimes we can compare different spaces in our population. And here we can do this here by GIS analysis to understand each factor is strictly related with lifestyle behavior and health indicators. And also, you can make the reverse for the civil engineer or the city planning as well. So here, one nice paper, they try to address this issue to understand each environmental factor is related with blood pressure mainly in Brazil. And they try to compare the school environmental factors related with blood pressure. As we can see here in the individual level, they have two levels, the contextual school and the individual levels. And you can see here, and the children live or get a school and place have sale food and so close to the school, they have lower, higher blood pressure, for example, for hypertension. This is a protective factor. So, for example, when they have individual level purchase foods in cafeteria, they have higher risk to develop hypertension. Why? Because the food items they buy in the cafeteria probably is soda or higher fat foods. So this is an indicator how we can promote health environment to avoid to sell this kind of foods for the children. So this is another important indicator for how the environment surrounding the children or the adolescents can to promote or not health behaviors, and this related with, in this case, hypertension. So as you can see here, we can start the relationship with cardiovascular factors as our subject for today. Start with the environmental factors and social determinants of health, and this can drive the people lifestyle. As I said previously, the people want to go to practice physical activity, or people want to buy a health food, but they don't have the access of this resource. They don't have a green park close to the house or the school, or they don't have place to buy health food. So, and this is strictly related with the behaviors, and this is why that Dr. Hook's sentence is so important, because sometimes we saw a lot of advertising that gene code is determinant for your health. These have a huge relationship with your health. However, if you have a good resource to have a health lifestyle, if this is related with you can block the gene pathway to develop cardiovascular disease, for example. And this is the why environmental factors is so important to our health, and also so important for climate change, for example. And try to understand what's happening here in South America. A few years ago, we started this project, Say Care Study. In the second phase of the project, we try to answer the question, what is the prevalence of the cardiovascular health in children and adolescents in South America? In the same time, we try to identify which environmental factor is related with this cardiovascular health in this population. So here is our data collection. Here is our research group in São Paulo. As you can see, we went to the schools and did the measurements at schools for children. Here we got some blood tests. Here's me a few years ago, make some anthropometric measurements. And here the children get some oral health as well. And here we try to get and deliver the questionnaire for the parents. And here another blood pressure you can see here, and here another anthropometric measurements. And in the end of our project, we could access almost 540 kids. And this is our outcome. A few years ago, American Heart Association tried to change the focus on the cardiovascular, because in epidemiology, it's traditional for disease or risk factors. And this statement from American Heart Association, they try to look at the another side of the coin. So what is the related with health? And this is so important because for pediatric population, as the previous said, so this is important to promote health, to avoid or try to understand what's the factor related with health in children and adolescents. And they built this statement last year and try to understand what's happening here in South America. So the life essential weight is 8 components, and they have 2 domains, the health behaviors and the health indicators. And here the health behavior is physical activity, mostly moderate and vigorous intensity, sleep time, health indicators, I will talk these parameters later, and smoke behavior. What's the physical activity? So they try to categorize the children practice physical activity science 0 until 420 minutes per day, and this is the threshold to consider the children adolescent physical active according to the guidelines. And the sleep time, you have 2 different categorization. For children with 6 up to 12 years old, this is adequate for the children sleep 9 up to 12 hours, and children have 13 up to 18 years old, they have to sleep 8 up to 10 hours. And here is how they consider children have health sleep time. And here this is more challenging, is eating patterns. They use the DASH, dietary approach to stop hypertension. And for each food items or food groups is if the children or the adolescent report they eat each food groups, they have some scores here. And in the end of this, you classify according to the quintile consumption, if they have health eating patterns or unhealthy eating patterns. And here you see the percentile and the points. This is important. I will show you later how you can manage in this. And for smoke, of course, in children, you don't expect children smoke. However, as saw the less prevalence, smoke starts to increase, mainly vape smoke in adolescents, and here is the classification. So they never try a little, and they you, so you decrease the scoring points. And this is worrying because, as you see, children and adolescents start to smoke these vape products right now, so this is a bad behavior. So another domain is health factors. You have body mass index, blood pressure, blood lipids, and blood glucose. So the body mass index is the weight and height, and according this, and according percentile for age and sex, you classify normal weight, overweight, and obese in this kind of levels. And the blood pressure, this is another challenge classification because as the children and adolescents growing and developing, the blood pressure increase not because the children and adolescents present hypertension, it's because the developing process. So for each age and sex, you have different classification according this. And however, we know if it is so higher, this is one indicator high blood pressure and hypertension this age as well. And here we have an example how to classify that. We have age here and the blood pressure percentile, and also the percentile for high. Because the children have high, they need more blood pressure. So, however, this is if the children presents 90 percentile here and 99 percentile here, this is one indicator they present high blood pressure or hypertension. And the blood lipids, this is important as well. So they have some classification in milligrams per deciliter. And of course, we expect the children don't present this, but however, as we know, the children have present the unhealthy food habits, they can increase the blood lipids as well. And another important health factor is the blood glucose metabolism. Here you have 2 different indicators, the fasting blood glucose or the hemoglobin glycate. Depends where or how the indicator you got, you can classify different. So In the fasting glucose, you have these indicators, and for hemoglobin glycate, you have these indicators. You can use one on another. In our project in South America, we use fasting blood and glucose. However, here in the United States, some project use the hemoglobin glycate. It's almost the same. It's strictly related, and then you can pick one of that to evaluate these factors in children, adolescents, even in adults as well. So this is our main results for SACARE study. That's 540 kids, and here we have the classification according age and divided by sex, and here the lifestyle life essential needs indicators. So the main results is in bold when you compare male and female. For example, the boys presents higher score for food habits. They present as well higher systolic blood pressure, and they present the average score for the health behaviors, and they present health factors as well. And also, when we compare the score here, how we did this score, you summarize for each factors here, 0 up to 100, as I showed previously, and you divide by 8, and these have the classification. Or you have the total score as this here. For example, the overall score have 73.6 points. When you compare female, have 71, and this is the overall score, or this overall cardiovascular health. And you can classify this in 3 categories as American Heart Association proposed to us. 0 up to 49 is lower cardiovascular health. This is the worst category. You have the moderate, 50 up to 79, and you have higher cardiovascular health, 80 up to 100. And this is how the American Heart Association changed the view when you compare it previously. When, for example, metabolic syndrome, these traditional cardiovascular risk factors we use almost 40 years. So here's the difference. We're looking for health. What is the factor related with health, not with related with disease or risk factors? And here we see 1 in 3 boys present higher cardiovascular health, and 1 in 4 girls present higher cardiovascular health. So as you can see, the prevalence is not so good, again, we expected. However, when you see the lower cardiovascular health present a lower prevalence, this is a good indicator. In South America, they present a good health patterns in this population. Right now, we test some relationship with environmental factors. This is another important health indicator, is iron, serum iron concentration. Why this is important, because serum iron concentration is strictly related with blood pressure and strictly related with anemia as well. So some children can present cardiovascular risk factors because they didn't lower level of serum iron. However, we test here the environmental factors here. The children live in a good neighborhood compared to children who live a bad neighborhood. We measure this by questionnaire. The parents respond questions about safety, about good sidewalks, good bike paths, and they have security to go to the park, or if they didn't have park close to the house. And this we test this hypothesis, and we found the environmental factors mediate up to 13% the relationship between serum iron and cardiovascular health. As we saw previously in the systematic review, and the air pollution is related with hypertension in this population. And here, as we know, serum iron can determine the cardiovascular health in children and adolescents. However, this can be strictly related with environmental factors. So, as I said here, the children live in a good environmental response by their parents, or the perception and perceived environmental factors. It's not a direct observation. This is a strict important because I can live in safe neighborhood, but however, I suffer some assaultment in my neighborhood, and my response is, "Oh, my neighborhood is not safe." For my neighbors, they don't suffer this, and for them, is a good neighbor to walk. So these perceived environmental factors is so important because they can determine my behavior, or in the case of the parents, can determine parents allow the children go outside to play sports or to walk or to stay outside to practice physical activity, for example, and this avoids sedentary behavior. Stay at home, play video games or computer, for example. This is important because this restrict related or mediate this association. So I can see here the children live in the perceived environmental, good perceived environmental presents mediates by the relationship between iron and cardiovascular health. This is the overall cardiovascular health that I showed you previously. So as we know, we have a lot of different factors related with cardiovascular health. However, to measure everything American Heart Association proposing to us can be expensive. It can be more expensive in low and middle income countries. Sometimes I don't have access to bring my kid to get some blood or to bring my kid to go a nutritionist evaluation, and this can be one barrier or one disparities to evaluate the cardiovascular health in populations. And because of this, we build with collaboration with my colleague, Dr. Alexandre Quevegato, from the LabDAPS, Laboratory for Big Data and Health Predictive Analysis from the School of Public Health, University of São Paulo. We built this nice project to try to develop some machine learning algorithms to predict each student presents a lower or higher cardiovascular health and in this population. So here, Dr. Alexandre, he is the director of the laboratory, and Dr. Thiago Oliveira is research in the laboratory. And Mateus, I don't have the photo from Mateus. Mateus is undergrad students work with us to develop these algorithm prediction models. What is the predictors? As we know, biological sex is related with cardiovascular health in pediatric population, and we put in sedentary times because it's related, sleep quality, food intake, bike ped walks, the mother weight because related with determination of the weight of the children, socioeconomic status, parental education, active commutes by bike, soft drink and water drink. This is our predictor. So as the literature showing us all these predictors is related with cardiovascular health, we try to understand each these predictors strict can useful to predict our cardiovascular health in children and adolescents. And we apply different approach on this project. So 15 different approach to determine our risk score. And here the preliminary results that we got. So Mateus and Thiago build this relationship. Here you have our prediction here, research center, where the children live, biological sex, and another predictors. As you can see here, water consumption and weight and BMI is related with one another's. So here the scale for this exploratory analysis. And we found the model built by random forest have higher precision when comparing others. Probably is the better one to predict cardiovascular health in pediatrics. And we found this good accuracy, 0.85. So this is the accuracy in the prediction models that we built based on that predictors. And here is the most important predictors for this health indicator in pediatric population. So if you build one questionnaire or one risk score based on these variables, we can predict with accuracy 85% each student present higher level of cardiovascular health. We use the passive transport, so the children don't use bike or walking to go to school, use bus, car, or motorcycle with their parents. They have higher level of sedentary behavior, BMI, water consumption, this is important health behavior, age group, soft drink, school type, when you compare public school with private schools, and when you summarize and other factors. So this is the most important predictors we found on our project. So to summarize my speech today, you saw we worldwide present higher prevalence and high blood pressure in adolescents, and this is so worrying because the most higher prevalence we find in developing countries. And why this is important? Because sometimes to treat hypertension in low and middle income countries is hard, mainly because the health resource is so low, or even they don't have public health system. And this can be challenging to treat or to prevent or to avoid the hypertension, for example, in this population, as I said, because they will live with this health condition for a long time. And this can predict stroke or heart failure so early in their lives, and this increase a lot health costs as well. However, we found if the children and adolescents practice physical activity even 60 minutes per day, they can prevent or can reduce the systolic blood pressure and diastolic blood pressure. And this can be one good health behavior to prevent or to promote health habits and to promote cardiovascular health in this population. American Heart Association present the lifestyle aids and as useful measuring. However, in pediatric population from South America can be so expensive. And this can be the reason we develop one score, try to predict each children and adolescents present higher risk to present low cardiovascular health or higher cardiovascular health. And we identified that one children and adolescent present lower cardiovascular health, we can indicate better to go to see a doctor, to go to see a nutritionist and health evaluation or take blood. When we compare the children don't have this kind of health risk. For example, if you identify one children higher cardiovascular health according to our prediction models. So I would not suggest to them to go to see a doctor, take blood, because they have lower risk to present this kind of health issues. And this can be good to not expense a lot of health resource on this. In Latin America, we found moderate cardiovascular health based in the American Heart Association. However, we found environmental factors as C and other systematic review in other population is related with, and the relationship with iron and cardiovascular health. And this is important because if you try to build more green space or to promote more farmers market, for example, you can promote health and prevent cardiovascular events, not only in children, but in also in adults as well. So I have to say thank you for our group, Take Care Study Group. I have to say thank you for my students in São Paulo. And without them, all these results will be impossible. And I have to say thank you for every children and parents participating in our study, and because without them as well, we don't have this kind of health indicator from South America. Thank you. And I strongly recommend you visit our website to get so the slide that I present here today on another webinars, and you can, you can scan here to see our another slides and webinars, and you can see the future webinars as well in the next couple weeks and next couple months. And here my contact, if you need some information that I specify here, please let me know, email me, I will be happy to respond to you. And I'm open for questions.
Yes, thank you, Dr. Augusto. We do have time for questions. Please put them in the chat, and I will be able to field those to Augusto throughout. And please reach out to Augusto if you have any additional questions regarding this or similar studies. Augusto, I do have one question regarding the measurements of LE8. As someone who does school-based work in the States, has that been done? Has there been large-scale studies that have collected those measures? Because they can be a bit, I don't know if they're considered invasive or not, but when we're dealing with schools, blood panels and stuff could scare off administrators to collecting that kind of data on children, even though it's important data. So has that been done here in collaboration with school-based health centers or school nurses or anything like that in the United States?
I think yes. As we did in São Paulo, some nurse from the hospital, University Hospital, School of Medicine, University of São Paulo, she goes with us to school, and she sees some place, private room that the children can go, and they clean everything, and they take blood there, and everything was sterilized, and we have some strong logistic to get the blood, and we have to the hospital laboratory in maximum 1 hour. So, and you can imagine São Paulo have 12 million people, so we need so maximum got some up to 10 up to 20 students per day per morning, and after that the nurses have to go to the hospital to bring. I think is it possible here in the United States. I just have to check ethical issues. In Brazil, we don't have this problem. Only if the parents allowing us to take the blood sample is good enough. We have to sign the form, the consent. But the logic is it was tough, mostly because São Paulo is a big metropolitan. But all the materials we got the previous day and at the hospital, bring to our laboratory, organize everything. In the morning, we leave from the school almost 5:30, because sometimes it take 1 hour and 1.5 hours from school to go to our school to go to the school. So, and this is the most challenging part. We have another projects, and they have a motorboy. We give to them with the thermal, and they bring all the blood samples to the hospital in 1 hour, maximum 1 hour.
Yeah, I'm sure that's sorry, go ahead.
Here in the United States, the only thing you have to access is this ethical problem. If you have the strict close to the laboratory to analyze the sample, because, for example, hemoglobin, we need maximum 1 hour after the take blood, and all the hemogram as well, maximum 1 hour. They need to go to the device to analyze that. Mm-hmm. And then other lipids and glucose, hemoglobin glycase is not necessary. You can storage and analyze later, but hemogram, right now we have some analysis about the infection and hemogram and hemoglobin as well, to see how is the immunology system of these children, and this need for maximum 1 hour after take blood, and this is the challenge part.
Yeah, I think ethically, procedurally wise, you could have protocols in place. I just wonder how receptive schools and parents could be to doing those measures, even though they're important. And it sounds like having that clinical person as part of the project, whether it be a nurse or a clinician, I think that would probably help sell that. Yeah,
we have the boss, we said, he's a sanitary doctor, a medical doctor, and we have the nursing as well. I can say you I think was up to 10% of the children deny to take blood. But
Isn't
you
bad.
have this, yeah, it's not bad. You have this domino effect. If one child start to cry, all the children in the room cry as well. It happened this, I don't know, 3 times, 4 times. And the better is, but some children is so strong to take bloods.
Sure. Okay, yeah, I think we have a question here. It says, was salt specifically taken into account when studying the effects of nutrition/malnutrition? This person says they recently heard Dr. Joel Furman speaking about U.S. children and high blood pressure in relation to salt intake on a particular podcast. So was salt taken into account throughout the study?
We do not measure the specific micronutrients. We divide in food items, as we know, so processed food have a level of salt or sodium. And we classify as unhealthy food items. And when you make the score, these will not score. For as you saw, 0 up to 16 points. If they eat a lot red meat or sausage or chips or another high fats or sodium, and we decrease the score. But specifically on the micronutrients, we do not measure that because our nutritionist thinking, and I agree with them, we don't eat sodium, we eat food with sodium. So it's better we measure why the children eat than the specific micrograms of sodium or another micronutrients. And this we classify by food items.
Another question. How can we effectively implement physical activity promotion strategies in the pediatric population, especially in developing countries, in order to reduce the prevalence of arterial hypertension and improve health adolescent cardiovascular disease? So this person is asking about, are there strategies in place for developing countries in regards to physical activity promotion? And are they different from the US strategies?
Yeah, this is $1 million question, if I know. But as I know, in some countries, for Chile, for example, they increased the PE class. I know there is mandatory one every day of the week, minimum 30 minutes. And unfortunately, in Brazil, they reduced PE class by the law. And this is one thing that'll be good. And another thing is create a safe place for the children practice physical activity. And another implementation depends of mainly in this kind of population, mainly depends on the regulation for the school schedule, for example. However, I think in Colombia as well, they try to increase to promote active commuting as well. So create bike paths so the children go by bike or walking to the school from home. So this is the mostly recently evidence that we have to promote physical activity and can address cardiovascular health as well. But it's hard implementation because not dependent on science, it's dependent on the politics.
And I think this question is relating to possibly the SACARE study. It said how many states were tested or have been tested?
In Brazil was 2, São Paulo in southeast, and Fortaleza in northeast.
And then as you were talking about the difficulty of strategies, I thought to ask, so in Brazil, is there a typical summer vacation like in the United States, 3 months off for school-age children?
Yeah, almost 2.5. Yeah. We have a sentence in Brazil. The all start of the carnival is in February. So since December 15 up to February 20, 25, depends when carnival happens, then they come back. Yeah. The difference is between the end of the year, compare here in the middle of the year. But they have 2.5 months of vacation.
And have any outcomes been measured on those during those breaks in Brazil?
We don't measure. Yeah. This particular project we don't measure because it depends on the school.
I'm just looking through to see if I hit all the questions.
Oh, sorry guys, I missed.
Sorry, y'all. We had a test of our fire system, so that was what you heard in the background. It looks like we did answer all the questions, Augusto. So thank you all for attending today's webinar. We appreciate you being here. Remember, this webinar, as Augusto mentioned, will be archived on the website at msdcenter.org. We will see you next time for a webinar featuring Sarah Bentley with UTHealth Houston School of Public Health in Austin and Leanne Ganser with professional data analysis, entitled Safe Streets for Everyone, Implications of School and Municipal Policies on Safe Routes to School Implementation and Equity, on September 14th at 11 Central Time. So with that, you have Augusto's contacts if you'd like to reach out for additional questions, and that will conclude today's webinar. Thank you.
Thank you for everyone.